At the Bundestag, the parliament, is DW chief political editor Michaela Küffner. Michaela, good morning. What can we expect from Angela Merkel's speech today?
Well, I would expect her to once again address MPs, but also the public directly, to take personal responsibility. She's greatly concerned that the initial easing of restrictions here in Germany, which means that shops can reopen up to a certain size, that some pupils and students can actually take exams and return to school, could lead to an easing of the feeling about what kind of threat the coronavirus is in Germany. She warns that this crisis isn't over, and I would expect her to prepare the ground for a new normal that would see Germany live with the virus rather than be able to beat it anytime soon.
What kind of form could this new normal take?
That's the big question, and people are asked to wear masks now nationwide on public transport. That's something individual states decided. And one has to understand that it's the federal states who in the end decide what concrete measures are taken. And Angela Merkel as Chancellor is something of a moderator in this process. So whatever she believes doesn't immediately translate into policy on the ground. Christian Drosten, the leading virologist here in Germany, also came up with his team with the COVID-19 test. He already fears that there could be a second wave of infections if this easing leads to drive a rise in those infection rates once again. So that's where science meets policy, and clearly the policy here in Germany, it's safe to say at all levels, has very much been driven by the scientific advice, but it always takes 2 weeks to learn what effect any action that's taken has had, and that includes the easing of restrictions. So what policymakers here want to avoid is that they might have to take back some of that easing. They want to provide something of a linear process, but we also heard from Health Minister Jens Spahn yesterday that there, as he said, would be a lot to forgive in the future. So there's an awareness here, and one has to say an honesty that policymakers believe, yes, they are making mistakes right now because they simply don't know what the future holds in terms of COVID-19.
In terms of the future, perhaps Asia might offer a bit of a glimpse on that, especially on the point of a second wave of infections, Michaela, considering Singapore, for example, is seeing that second wave of infections. But just going back to a point you made earlier about Chancellor Merkel being a moderator in policy making at the juncture where policy meets science, I wonder how this is going to play out in the future, considering that Germany has a federal structure and individual states can determine their own policies. What is the role that Chancellor Merkel is playing within this setup?
Well, she's the one who actually knocks the heads together in the end and holds regional leaders and state premiers to account in that sense. She can ask them, she can advise, she can call on them to do something. But what measure is taken, and we saw it with the face masks issue, that they couldn't agree when they all sat together on that being nationwide. And then once state by state they introduced that, at the same time there are great differences in which shop sizes can open, how many pupils are actually returning back to school. But one also has to know that the spread of the coronavirus here in Germany is also very, very different.
Michaela, sorry to interrupt
according
you, but
to which state you are in.
I can see Chancellor Merkel is there at the podium and just beginning her speech. We'll just go there directly now.
Ladies and gentlemen, these are extraordinary, very serious times that we're experiencing here. And the government and the parliament, the entire country, are being tried as they have not been tried since the Second World War, since the years in which the German Federal Republic was emerging. What's on the line is the health and the lives of the people in this country, and it's about solidarity and cooperation in Germany and in all of Europe. I am standing here speaking to you as the Chancellor of a German government who in recent weeks has concluded measures here which are unprecedented. There's nothing that we can orient ourselves on. In the past, We have introduced bills that we have asked you to approve. We have freed up money that was unimaginable before the pandemic. And I would like to thank the German Parliament, the Bundestag, as well as the Upper House of Parliament, the Bundesrat, for working as quickly as they have, both in consultation and in their approvals. For weeks now, we have been living in a pandemic. Every single one of us has had to change our lives to fit with the new conditions, private lives as well as in terms of work. Everyone knows what they find particularly difficult, and I know that living under corona conditions seems like it's been going on for ages and ages for everyone. No one wants to hear this, but it's the truth. We are not in the end phase of the pandemic. It is still very much in its inception. We will be living with this virus for a long time to come. And the question of how we can prevent this virus at any point overwhelming our healthcare system, taking countless lives with it, is a question that will be the key question for politicians and policymakers in Germany and Europe for a long time to come. I am aware of how hard it is to live with the deprivation that we have to live with, both as individuals and as societies. This pandemic is hard for democracies because it restricts exactly what our needs and rights are, both needs as parents and as children, as adults and as young people. And we can only do it if everyone understands why we are restricting our freedoms, if everyone knows that we are allowed to express criticism and that we listen to each other, say these things. Freedom of press helps, our federal structure helps, but trust in one another helps too. And this is something that in recent weeks we have seen in Parliament and across the country. The way citizens were committed to one another, the way citizens restricted their needs for one another, it is nothing short of remarkable. And let me assure you, I think I have never made a harder decision than the decisions that I had to make here in terms of restricting people's freedoms. I find it very hard if children cannot meet their friends without difficulty and miss this. I find it very hard if people can only ever meet one other person apart from their household when they go for walks and always have to adhere to the minimum distancing. And I find it particularly hard when I think of senior citizens or people in nursing homes or people with disabilities who are in residential homes. They are particularly vulnerable, and it's much, much harder for them not to have visitors than for the rest of us. It's really cruel because the nursing care staff who do everything they can, but the thought of people losing their lives without their loved ones near them is very, very hard. Let us never forget these people who are living in isolation, these octogenarians, nontogenarians. They have built up our lives. They are the basis on which we build our prosperity.
Sie sind Deutschland, genau wie wir, ihre Kinder und Enkel.
They are Germany, just as we are, their children and their grandchildren, and we are fighting this virus for them as well. But I believe it is necessary that we continue to maintain these corona restrictions if we are to protect what is at the heart of this country, namely the life and the dignity of every individual human being. Through the discipline of recent weeks, we have managed to slow the spread of the virus. Now, that doesn't sound like a lot, but it's actually something incredibly valuable. We have gained time, and this time that we have gained, we have used well to strengthen our healthcare system even more. The hub of all of our efforts in the medical area are the ICUs, because it is here that the most severely affected patients are treated. We have heard of the terrible reports of intensive care units in other countries that were completely flooded. The fact that it has not yet happened, and the aim is that it not yet happen in the future in Germany. And I want to thank the Health Minister Spahn, as well as all of the other health ministers on a regional and local level, for the successes they have achieved in not overwhelming our healthcare system. We have expanded the number of ventilation beds that we have. With the new legislation we've put in place for COVID, we have ensured that our hospitals can expand their ICU bed number. And what we see is that so far our healthcare system has stood the test. Every corona patient, even in the most severe cases, have received the best possible treatment. And we owe this also to the hard work of the nurses, of the paramedics, of the physicians, and all of the people who work in hospitals as hard as they can to make up what we call our healthcare system and to make it what it is. We thank them by this applause, and I also want to thank soldiers of the German armed forces who are also helping out in this effort. Perhaps a role that we often don't think about is the public health service. Nearly 400 local departments of health and public health agencies are working here, and if we manage to contain this virus properly in the months to come, we need to have stronger health departments than we had before the pandemic. And this is why we have decided that these public health agencies need to have more staff so that they can combat this crucial effort, namely tracking all of the contacts of each confirmed case. The Robert Koch Institute will put together 105 mobile teams of students, the containment scouts as they are called, who can be seconded to any agency who needs them. We have also looked at the question of personal protective equipment, providing PPE, particularly for medical protective masks, has quickly become one of the key efforts that we need to tackle, not just for Germany, but across the globe, because without healthy nurses and doctors, ICUs and ventilation systems do not help anyone. So there's a very tense market for these products across the globe, and this is why the German government, although we are not responsible according to the Infection Act, we have decided that we will centrally coordinate protective medical equipment, and I want to thank all of the companies who are helping us in this effort. The pandemic is teaching us that it is not a good thing if we only import protective equipment from abroad. Masks that cost a few cents can become a strategic factor in a pandemic. Germany and the European Union are therefore working hard to become more independent from third countries. And this is why we're expanding our protective equipment facilities in Germany and Europe at full speed. What has been helpful for us in this first phase of the spread of the virus have been, apart from the relatively high number of ICU beds, it's also been the testing capacity in labs. All the experts say to us, testing, testing, testing is the way forward. And that way, if we test more, we'll have a better sense of the pandemic, the number of unreported cases. We'll be able to test our care professionals more to sink the level of danger of infection in hospitals, which is why we've continuously expanded our testing capacity and will do so moving forward. But we can only really end the pandemic with a vaccination, at least based on everything we know about the virus so far. In a number of countries worldwide, researchers are trying to find a vaccination. We are funding this as the German government so that Germany, as a research location, plays its role too. We are also offering financial support for vaccination initiatives like SIPI, developing a new vaccination and ensuring that we have a COVID-19 research network in Germany. We have freed up large amounts of money for this so that researchers and physicians at all university hospitals can work to tackle this problem. We will need many clinical trials and we will need antibody trials as well, and we are well positioned to do this. But science is never national. Science serves humanity at large, and this is why it's a matter of course that all of the medications and antibody tests that we managed to discover must be made, and vaccinations must be made affordable for the entire world and made available for the entire world. A virus that can spread to nearly every country can only be pushed back and contained if we all join forces across the globe. International cooperation against the virus is very important for the German government. We coordinate with the European Union and as part of the G7 and the G20 with decision to support the 77 poorest countries in the world by stopping all payments of interests and debt payments eases the burden on these countries. But in this support, there needs to be even more done. For the German government, cooperation with the countries of Africa has always been a focus, and in the corona crisis, we need to step up this support, and not just to Africa. Not just in Africa, but often there. The World Health Organization, the WHO's work is very important. For the German government, let me say that the WHO is a crucial partner, and we support it fully in fulfilling its mandate. Ladies and gentlemen, if we look at the latest figures of the Robert Koch Institute here, the indicators suggest that we are going in the right direction. For example, we are slowing the infection speed, which every day we have more people who are recovered than new confirmed cases. This is a success in an interim level, but because these figures trigger hope, I feel the need to say that this is a very fragile interim result. It's very much thin ice, in fact, the thinnest of all ice. The situation is deceptive, and we have not yet passed the peak. Because in combating the virus, we always have to bear in mind that today's numbers reflect the infection occurrences of 10 to 12 days ago. So the figures of new confirmed cases today doesn't tell us how we're going to be in 1 or 2 weeks if we have far more contact that we have allowed through relaxing corona restrictions. Colleagues, I want to use this opportunity to explain in a little bit more detail what concerns me most at the moment. Naturally, political decisions are always part of a weighing up process based on the information that we have available at the time. And this is true when it comes to combating the corona pandemic, which will massively impact on the well-being of the people in this country. And in this weighing up process, which no one in the national government or in the federal states takes lightly, I know this. When it comes to combating the coronavirus, it's my conviction that if at the start of this pandemic we have endurance and discipline, then we will be able more quickly to unfold our public life, our social life, our economic life, our political life. And this is if we do not get lulled into a false sense of security by figures that look encouraging. If we are disciplined in the beginning, we will ensure that the healthcare system and our social lives and our economic lives they will be able to improve better. The virus will still be there, but if we concentrate and focus in the beginning, we will be able to prevent switching from one shutdown to another without having to isolate groups of society from everyone else and without having terrible, catastrophic situations in our hospitals the way we've seen in other countries. So the more consistent we are in living with these restrictions, reducing the reproduction factor, the more we will benefit in the future, because then we will be able to track every infection chain and thus to contain the virus. And these convictions are what drive what I'm saying here. Let me tell you, I support the agreements that we made last Wednesday on the national and the regional level, but the way they've been implemented is causing me some worries, because it seems that it's gone too far in some ways when it comes to loosening restrictions. When I say that, that doesn't mean that I'm questioning the sovereignty of our federal states. They are responsible for many areas of life. And of course, when it comes to the Infection Protection Act as well, I do not question this in any way. Our federal structure is strong. Don't get me wrong here. This is why I'm spelling it out. At the same time, I feel I must admonish everyone not to trust in the principle of hope if we are not convinced of this. And this is why when I spoke with the state premiers and in this room as well, and let me say, let us not risk a relapse by losing what we have gained, by being too casual. It would be a terrible shame if our hope punishes us. Let us remain alert and careful in the next phase of the pandemic. This is something we're in for the long haul. We mustn't lose our energy before we reach the end. And of course, that means we cannot return to our life that we had before the pandemic. Our everyday lives will be different, even if the digital tracing models can be used as they are planned. And the strict hygiene and distancing and contact restrictions will remain important. And this is true around opening daycare and schools. The federal states are practically looking at how they can open the schools and are preparing for this. And we will need an awful lot of imagination from everyone involved. And I want to thank everyone who's working towards this now. And I know that there's an awful lot of people working to make this happen safely. Now, I talked about Germany being tried as it has not been tried since the Federal Republic of Germany began. And this is true for our economy as well. We will only really see the true impact by the end of the year. And when the economy will recover again, none of this can be predicted now, seriously, because this depends on how well we combat the virus. The pandemic has hit us at a time when we have sound, balanced budgets. Years of careful policy making put us in a good position for this, and we need to ensure that we protect the workers. We've had millions of applications for various different aid funds, and millions of people have already received financial support here. We were able to pass these laws quickly with a lot of support. Our parliamentary democracy is strong, it is robust, and it is very quick in a crisis. Yesterday, again in the coalition meeting, we concluded other agreements as well, and you will be informed about these. But all of our successes can only really work if we are successful within Europe as well. Now, you've often heard me say here that Germany can only thrive if Europe thrives. And today, this is more true than ever before, and I mean it very seriously. So how does this look in practical terms? We have more than 200 patients from France and Germany. In Italy, we've treated in ICUs. We have sent medical equipment to Italy and to Spain and have helped repatriate thousands of stranded Europeans together with our own citizens. And I want to say thank you here to all of the staff in the German Foreign Ministry. You can't imagine how many Germans are outside of Germany at any given time, but we were also able to help many other Europeans get home. And thank you. And we worked together to combat the massive collapse of the economy here, and we've put up programs of 500 billion euros to help our business communities, and Mr. Scholz and other finance ministers in the EU have agreed on this, and now it's about making this 500 million available, and the German Parliament will have to pass certain laws on this and agreements on this, and I hope by the 1st of June this money will be there, because it's money for small and medium-sized enterprises, and it's also about short-time work compensation for member states who may not have the money to pay short-time work compensation to some of the workers there, but something that will really help. Now, some are calling for, both our partners, but also as part of the German political discussion in the face of this severe crisis, to have joint debt. And this is something that we'll be discussing this afternoon at the European Council video meeting. Imagine the political will were there for joint debt. If this is true, then all national parliaments in the European Union and the German Bundestag as well would have to decide to change the EU treaties such that some of the budget rights be devolved to a European level and be scrutinized democratically there. This would take a lot of time, it would be very laborious, and there'd be no one who could be helped immediately, because the point is we need rapid help, we need a rapid response to people suffering in the crisis. In the European Council meeting today, we will also be looking at how in Europe, in a time of very strict rules and regulations, how can we act quickly? Because, of course, we need to have tools to combat the consequences of the crisis in all of the member states. And in this context, I think it is important that the European Commission now and in the weeks to come continuously looks at how the various different sectors of the economy are impacted on by the crisis in different parts of Europe and what need for action there is. This is true for the immediate support of the European economy. A European economic stimulation program in the next 2 years could support the economy across Europe, and we will work towards this. In our consultation today, it won't be about looking at what sort of scope we're after or what sort of details we're after, but one thing is clear, we need to be willing, in the spirit of solidarity over a period of time, a limited period of time, to have much higher payments possible to the European budget, because all of the member states in the European Union need to recover from this blow. An economic stimulus program of this kind, right from the word go, has to be conceived of bearing in mind the EU budget, because the common EU budget has been the tool of solidarity-based financing of common tasks facing us in the European Union and has been for years. I will be pushing for the European Council to look at fundamental questions soon. Where do we need to work more closely together on a European level? Where does the European Union need further skills? What strategic capabilities do we need to have or maintain in Europe, not just in terms of financial policy, the digital policy, and the single market? We could take this European Union further, but also in terms of the rule of law, European security and defense policy, climate policy, and migration. On all of these levels, European solidarity is necessary. President, colleagues, for us here in Germany, the commitment to a unified Europe is part of who we are as a country. This isn't just empty words. We throw our lot in with the other European states. And facing this incredible challenge of the pandemic is a time for Europe to prove this. This pandemic affects everyone, but it doesn't affect everyone equally. If we're not careful, some will use it to divide society. Europe would not be Europe if it does not act like Europe. Europe would not be Europe if it doesn't stand there, be there for one another in times of dire need that no one is to blame for. In this crisis, we need to show who we are and who we want to be as Europe. And so at the end of my speech, I want to refer again to this sense of cohesion, cooperation. As paradox as it may sound, in weeks in which the behavior rules have forced us into physical distance, at a time when we need closeness, we have joined forces. And by thinking for the entire community and all of Europe, we have managed to slow the spread of the virus. Here in Germany, no government can prescribe a thing like that. A government can only hope that its citizens will embrace this, will work on the basis of reason, will act with compassion for other people, for their country, for everyone, and it makes me incredibly grateful. And I very much hope that we can continue in this manner in the next weeks and months ahead. It's going to last a long time, I know that. But after the first weeks of the pandemic, I have to say, I believe we will succeed in tackling this challenge, both as a society in Germany and in Europe as a whole. Thank you.
Merkel there making her speech to the German parliament, stressing on a number of points, particularly in relation to solidarity, both within Germany and also particularly importantly, perhaps, within the European Union. It's been a question that has been at the heart of the coronavirus debate and questions that have been raised about how united, in fact, are countries within Europe. Angela Merkel making her position clear on that and also making providing a few hints as to how the EU Council meeting of leaders, which will be held via video conference later today in the afternoon, as to how that will be progressing. I believe we have DW Chief Political Editor Michaela Küfner with us, and Georg Mattes is joining us from Brussels. Michaela, I'd like to come to you first in Berlin. Very short question at the very beginning. What were the key takeaways from this speech?
Well, that Angela Merkel very much came out here at the beginning as the mother of the nation, calling on the federal states, and we got a clear idea of what her role is here to actually get those states to find a common line on key issues over the outbreak of COVID-19, that she wants them to pull together and that she wants Germans to understand that, frankly, politicians don't have all the answers right now and that this is set to be the new normal, living with corona until there is a vaccine. And that's the big open question right now.
But she also stressed a bit about, she talked a bit about the federal structure of Germany, didn't she? She alluded to that. She said something along the lines of some states might have gone a little too far in loosening restrictions, and there needs to be cooperation on that front.
Well, essentially, there was a negotiated agreement on how to start loosening those restrictions in place here in Germany. Federal states agreed on those, and then something happened that she disagrees with and that she's deeply concerned about, as became clear here today once again. That's been the debate all week, that states might enter a kind of competition who's first to take those steps to a return to normal. Well, she says that getting ahead of themselves might risk losing this early success in containing the virus here in Germany. It's actually on her scale, almost emotional, and how deeply troubled she appears to be about losing this initial success, and that Germans must remain vigilant and cautious. And the last thing she wants to do is to loosen restrictions and then have to pull all of that back again. She stressed that this is one of the most difficult decisions, actually these restrictions on civil rights, essentially, that she's had to take in her career, which is more than a decade here in Germany.